Thank you, Shireen, and good afternoon, everyone. With school opening next week, I know that concerns over the pandemic are adding to the usual back-to-school jitters. I hope that parents, teachers, school authority staff, and anyone who is concerned about school reopening has had a chance to look at the online toolkit produced by Alberta Education. It provides a parent guide in 7 languages on what you can do to prepare your child for the new school year. The toolkit also lets you read all the guidance documents that apply to schools, including school reentry, sports, and libraries. Those guidance documents are based on the best available science and on reviews of educational experience from around the world. They also provide the specific actions that all parties must take to keep students and staff safe and prevent spreading the virus in our schools. I also hope that parents, teachers, and anyone else with an interest in school reopening have had a chance to look at the resource guide for COVID-19 outbreaks in schools, which was released late last week. That guide sets out specific protocols should a school experience a single person with symptoms, a confirmed case, or multiple cases leading to an outbreak being declared. What is not specified in this document is what has to happen to trigger a school closure. This is intentional and meant to ensure that each situation gets a full assessment. Return to in-school learning is complex, and a number of factors will inform any school closure decision. Each situation will be different. For example, it is possible that a social event outside of school results in spread, and many students who attend a school are impacted, either as cases or close contacts. A school outbreak may be declared as a precaution during an investigation with this instance, but does not necessarily mean that the school environment is unsafe and should be closed. Conversely, in an investigation of a small number of cases in a school, it may happen that a large number of exposures are identified, and closure of that school may be warranted based on that particular situation. In order to ensure that all tools are available to public health and educational teams, as would be appropriate to the local context and situation, we are not predetermining specific triggers for school closure. We will be carefully monitoring the implementation of in-school learning in Alberta. This close monitoring will be used to detect any early signs of concerns that will inform ongoing evaluation of our public health advice and school reentry plan. I know this may cause concern for parents and teachers who might prefer a single number to watch for. I assure you that teams at AHS, Alberta Health, and Alberta Education will monitor the situation in schools very closely. We will be in frequent contact with school authorities and each other to exchange information. We will be looking at factors such as absenteeism, school outbreaks, and community transmission rates. I will continue to provide my best medical advice and Alberta evidence to help decision makers. My advice will evolve and will always be based on my assessment of the best balance of all health supporting interventions in schools. I have family members who teach and children in school too. Both personally and professionally, I am committed to a successful return to school. Now I will turn to today's update. I am pleased to report that 11,923 Albertans have now recovered from COVID-19. We identified 108 new cases in the last 24 hours. 6 of those cases are at the Bright Horizons daycare and out-of-school care location. The daycare closed on August 20th. The infant and preschool room opened yesterday, August 26th, because it had no reported positive cases. And let me correct my previous statement. All 6 cases were not detected in the previous 24 hours. These are cases that have been detected over the past several weeks. We do continue to monitor the situation at Bright Horizons. Today, there are 1,158 active cases in the province. 49 people are in hospital, including 7 in intensive care. We completed 10,089 tests in the last 24 hours, bringing total tests to 922,397 so far, with 736,405 Albertans tested. I must report 2 new deaths, bringing the total number of people who have died from this virus to 237. Every one of them was a father, mother, son, daughter, or other loved one to families and friends. I offer my condolences to all who are grieving losses of any kind right now. Protecting those we care about from sickness and death is why so many Albertans are taking distancing, sanitizing, and masking seriously. I thank those Albertans who are doing their part every day to stop the virus in its tracks. I also want to thank school staff, administration, and teachers, as well as parents and students for all the work going into planning a successful re-entry to school. Whether your family has students returning to school in person or online, this will be the first time any of us has gone back to school in a pandemic. It is natural to feel nervous, excited, anxious, or any other emotion we may be feeling right now. One thing that can help in addressing anxiety is information, and I want to address a few key questions I have received about schools. One is about what happens if there is someone sick in a school group. First, a student, teacher, or staff member who develops symptoms at home cannot go to school. Public health measures for schools include a screening questionnaire. Parents should go through the questionnaire every morning before school to determine if the child can go to school or needs to stay home. Students, teachers, or staff who develop symptoms at school must be immediately isolated and sent home as soon as possible. Anyone who is sick must stay home and away from others, and testing should be arranged through Alberta Health Services. I want to remind everyone that pharmacies can only test people who have no symptoms and no known exposure. If the person with symptoms tests positive for COVID, Alberta Health Services will identify and contact everyone who had close contact with that case, offer testing, and outline the isolation measures for those contacts. Only the close contacts of that particular case are required to isolate. Think of it like a relay race, only this is a race where the goal is to drop the baton. If the first runner in a race, in this case, the COVID case, doesn't give the baton to the second runner, in this case, the close contact, that second runner, the close contact, can't pass the baton to a third. Let me give you an example. If my child is in a classroom where there has been a single confirmed case, and my child was in close contact with that case, they must stay home for 14 days. While they are at home, they should be watched for symptoms, and they should not be in close contact with other family members for those 14 days. If I and the rest of my family can stay distanced from them during this time, we do not need to also stay home. Clearly, younger children will need someone to stay home with them, and they may also need close care. If this is the case, one parent or guardian should be assigned to that responsibility, and others in the household should stay distanced if at all possible. That way, if the contact becomes a case, there will be less likelihood that they will have passed the infection to others. Another common question is how close contacts are determined. Generally speaking, anyone who has been within 2 meters of a case for a cumulative total of more than 15 minutes in a day without adequate protection would be considered a close contact. There may be many classmates, therefore, who would be close contacts if a case was at school while infectious. Also, any contact outside the classroom who shared food or drink or had contact such as hugging or kissing would be considered a close contact. Non-medical masks are not considered sufficient protection for a student or teacher who has spent time in close contact in a classroom with an infectious COVID case. So a student wearing a mask could be considered a close contact if, again, they were within 2 meters for 15 minutes or more in the course of a day. However, each case will be dealt with on an individual basis. Alberta Health Services investigators will determine who spent more than 15 minutes within 2 meters of the infectious case, and they will provide advice and recommendations based on this assessment. I have also been asked what constitutes an outbreak at a school. We are defining an outbreak as 2 or more confirmed cases in staff members or students within a 14-day period, or 2 or more confirmed cases that are linked to a school setting. Parents, staff, and teachers will be notified of outbreaks at the school that they attend or work at. They will also be informed if there is a single confirmed case identified in their school. Confidentiality of the individuals involved will be protected, but our protocols emphasize transparency at a school level to be sure everyone knows what is happening. The school's communication will also outline the next steps for staff, parents, and students. We will also publicly report on school outbreaks in line with other outbreak reporting. If needed, Alberta Education will make decisions on alternative instructional delivery plans or school closures with input from local officials. This will also be based on my best medical advice. It's also important to know that if an outbreak in the community poses an increased risk in a school, public health officials may direct schools to follow additional preventive measures. I urge every parent to read the school resource guide and other guidance for yourself. For added detail, please also read your child's school and school authorities' specific COVID-19 plans. Finally, I want to address the question about delays in accessing testing and completing notification and contact tracing. The teams at Alberta Health Services have been working tirelessly to decrease the wait times, to speed up transportation of samples and entry into the lab, and to increase capacity of our frontline teams to notify people of their results and complete contact tracing. This work is essential to get information on test results into people's hands as quickly as possible and to complete contact tracing to make sure that onward spread is minimized. One key development in making this information access better is an update to My Health Records that was completed this week. My Health Records is your portal to accessing your medical records, and it is the fastest, most convenient way for you to access your COVID-19 test results. Effective immediately, when you sign up for My Health Records for the first time, you will now be able to access test results as soon as they are entered into the system. This access will expire after 30 days if account verification is not completed. So please take the time to finish this step in order to keep your account available to you over the long term. Albertans over the age of 14 can sign up to My Health Records on their own and view their COVID-19 test results, as well as other common lab results, immunizations, medication history, and other personal health information. There is a great deal of work being done by many people to protect our health in many ways, not just from COVID, but from other risks as well. Thank you to everyone who is giving their best work to making our new normal as vibrant and safe as possible. Thank you, and I'm happy to take any questions.
Before we begin with the questions, I'd like to remind everyone to please keep to one question per turn and to indicate who the question is for. We'll go to the phones now. Operator, please put forward the first question.
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. This week, many kids' summer sports leagues are wrapping up after playing in 50-person cohorts for the last 2 months. Given that there haven't been major outbreaks amongst teams, how soon do you see expanding the size of sports cohorts to 100 or larger than 50? In addition, in some municipalities, parents aren't allowed in hockey rinks to watch their kids play. Do you think that should be lifted at some point in the near future?
The question about increasing our cohort sizes, whether it's for sports or other activities, is something that we would look at once our school reentry has been completed and we've had a chance to monitor that. It's a bit premature to think about expanding cohorts or other kinds of activities until we have a chance to monitor the impact of having students go back into school and whether or not that impacts our transmission rate significantly. But as you say, we have been pleased with the success that our sports cohort model has had. As you say, we have not had significant outbreaks, which is encouraging. And so that is something that we can consider, but again, not until we've completed school reentry and the monitoring around that particular process. And I'm sorry, there was a second question. I didn't bring my pen with me. What was the second question?
Parents attending.
Parents attending hockey rinks. So our current guidance does allow for seated indoor spectator events up to 100 in the stands. And so if a local authority is making a different decision based on their local epidemiology or perhaps other factors, those would be questions best addressed to those authorities, as our current guidance in general across the province does permit spectators at those kinds of events. However, again, local groups may be wishing to make different decisions based on their own context.
Operator, please put through the next question.
Next is Kendra Slagowski with Global News Edmonton. Go ahead, Kendra.
Hi, Dr. Hinshaw. I just wanted some more clarification when it comes to sports cohorts. Hearing from parents, they're wondering, can I sign my child up for example, hockey, and can they also do swimming lessons if there is distancing or if the group is smaller? And also wondering if you can tell us what are the signs of a second wave if we were to have one?
So parents can, we have not officially restricted the number of cohorts that children can belong to. Having said that, it would be my recommendation for parents, especially as school is going back in person, to keep the number of cohorts that their children are part of to as small a number as possible. With respect to activities like, for example, swimming lessons, or there may be other activities where children can be distanced more effectively than in, for example, a close contact team sport. Again, there's nothing stopping a parent from having a child in a team sport and in swimming lessons, but it would really be up to that particular family to look at all of the activities that the household members are involved in, considering going back to school if their child is going to school in person, and considering then how they might, at least for the first month or so, limit the total number of close contacts that their child has until they can get a sense of how that plays out in their particular family and household. But again, if a family wishes to have a few cohorts, that's not forbidden. I just would ask families to consider how they might reduce the number of close contacts, especially in this next month.
Just another reminder, one question per turn, please. And as also a reminder that Deputy Minister Cobold is here if you have questions for Alberta Education. Next question, please, operator.
Next is Andrew Walker with 88.1 FM. Go ahead, Andrew.
Hi, Dr. Hinshaw. During Monday's update, you mentioned that family members who host a gathering should start taking notes of all relatives who visit them during a 2-week period to help with contact tracing. With the high amount of active cases coming from adults in their 20s and 30s, is this something young adults should do? And if so, how will the province encourage them? Which friends they've been around for 2 weeks?
Sorry, Andrew, we can't hear the rest of your question.
Is this something that adults in their 20s and 30s should do, track down, write down who they've been in contact with for 2 weeks? And if so, how can the province encourage them to do that?
I would encourage anyone who is spending time with others, coming into close contact with them, to make notes about who they're in close contact with, and as you say, to keep that for a couple of weeks, just so if they happen to become a case of COVID, or if they happen to be exposed to someone, they'll have a clear record over that time period that can quickly be used by contact tracers. We are working with a small group to look at focus groups of younger adults to understand what is the most effective way to communicate with them. And so once we have a better understanding of some of the methods and the ways that we can communicate most effectively, then this kind of messaging would be something that we could include in those targeted messages to young adults to encourage them to take this additional measure to help speed up contact tracing if there should be an exposure in their group of friends.
Next question, please, operator.
Next is Jeff Slack with 660 News. Go ahead, Jeff.
Hi, Dr. Hinshaw. Just wondering how confident you are in the back-to-school plan and if you believe that we can avoid a school closure from COVID.
I believe that this is the right first step going back to school. I think there is no one perfect way to go back to school, and I am convinced that it is critical to help our children get back into school in person and to work on balancing the risks of COVID with the risks of all of the other things that our children face, the risks of not being in school, for example. So I do believe this is the right first step. I believe it's critical to closely watch, evaluate, and monitor the impact of that. It is entirely possible we could have a school that does need to be closed if we see spread. That is possible. But what I would say is that there are hundreds of schools across the province. We need to take this first step, evaluate, monitor, and if there is something we need to do to adjust, whether it's adjusting in all of those schools or adjusting in targeted locations, that's something, again, that will be part of our evaluation, monitoring, and feedback process. So I think, again, a single outbreak in a school or a single school that unfortunately may need to be closed wouldn't, in my mind, invalidate this first step that we're taking. It's simply a part of that ongoing monitoring and feedback process that we're undertaking.
Next question, please, operator.
Next question is Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hi, this is for Dr. Hinshaw. There have been 12 long-term care and other similar facilities that had outbreaks in Edmonton now. So just wondering if you're looking at considering changing any of the protocols around letting people in or other measures in those facilities. For instance, at Kensington Village in Edmonton, it's the second time there's an outbreak there. 4 people died there in the last outbreak. Also, if you can tell us anything else about the outbreak at the Edmonton Church. There's 99 cases there last time I checked, and it seems substantial. Anything else you can tell us about that outbreak there?
We have had, as you reference, several outbreaks in Edmonton long-term care and supportive living facilities over the past month or so. And in the vast majority of those outbreaks, we have not identified that it was, for example, a visitor who was the source of infection. The ongoing monitoring of these long-term care facilities and making sure that we are doing everything we can to keep them safe is continuing to be underway. And we are looking at the larger outbreaks that we've had to make sure that we're learning everything we can from those. However, it's also really critical to remember that there are multiple risks to individuals in these settings, and we heard very clearly when we did our engagement with residents of continuing care settings, families of continuing care settings, operators and staff, that if the only risk we consider is COVID and we don't consider risks of isolation, loneliness, and some of the other things that were happening as a result of, particularly of our visitor restrictions, that we're not considering that whole health of those individuals. So we do continue to monitor the update to our visitor restrictions. So far, we haven't seen that those changes have caused significant risk or are a driving factor in these outbreaks. Rather, I would say that when we have more community spread in a particular area, there is a greater likelihood of anyone, whether it's a staff member or someone else who goes into those facilities, being exposed in the community. So the best thing we can all do to protect continuing care is for every one of us to take those public health measures, those protective actions in our everyday life, because while we personally may not be at high risk, we could be a conduit. I talked earlier about that relay race. We could pass that unwanted baton of COVID to someone else who passes it to someone else, and we could be a part of that chain that gets it into a high-risk facility. So it is really important, again, that we are all part of the solution, and that we're making sure that we're working together to prevent these outbreaks. With respect to the church, one of the first things I will say is that it is completely unacceptable to target individuals who are part of an outbreak and to stigmatize them because they have been impacted by COVID-19. And so there have been some reports that this particular church has received threats and members have been treated inappropriately. And I would repeat my call to Albertans to treat each other with compassion. We must respond to COVID, not with anger and fear, but with compassion, and support each other to take the appropriate measures. At this time, there are 100 known cases in that particular outbreak. And we know that because this church is participating in the outbreak investigation. They are cooperating with public health, and we are working very closely together with that church and making sure that anything that we can learn about, whether it's our protocols that need to be updated, whether it's communication and supports and resources about our protocols, that we can do a better job working with other places of worship to make sure that we're closing gaps. So while there are many cases associated with this particular outbreak, I would repeat that it is critical that we treat anyone involved in any outbreak with respect and compassion, that we support people to do the right thing, and that we think in our own lives, how can we be sure that we are taking the public health guidance to heart every single day, because it could be us who are involved in an outbreak tomorrow in an incident where perhaps there was just a slip up at the wrong place, the wrong time. So again, this is something that we are all in together.
Next question, please, operator.
Next is Matt Woodman with CTV Edmonton. Go ahead, Matt.
Hi, Dr. Hinshaw. This outbreak at Bright Horizon Daycare, I might have missed the location, but is that the daycare in Edmonton? I'm also seeing some locations in Spruce Grove and Sherwood Park. And then my next question, another quick one. How concerning is this outbreak at a child care center, given school starts next week and we already have an outbreak at some form of a child care center?
It is. So the Bright Horizons Center is in Edmonton. And as I said, there are 6 cases in that particular outbreak at this time. I think what's really in some ways reassuring about the childcare outbreaks that we've had to date, since the pandemic started, we have had only 16 cases that have been identified in outbreaks in childcare settings. And there have only been 6 outbreaks that we have detected in those childcare settings. 3 of those 6 outbreaks were limited to a single case where an outbreak was simply declared as a precaution. In one of those, there was only 2 cases that were identified. And so really out of all of those outbreaks that we have responded to, investigated, and public health has put precautions in place, we only have 2 that have had more than 2 cases. And I'm confident that the measures that are being put in place are going to be sufficient for those particular places to limit transmission. So I think what we can conclude, at least from our experience so far, is that when our public health guidance is followed, when outbreaks are rapidly identified and measures are put in place, we can stop spread very quickly.
Operator, I believe we have one more question.
That's correct. Our final question is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. In determining close contact, how and why was 15 minutes chosen as that particular threshold? And also just to re-ask the question from my colleague, you mentioned that whether we see a second wave and how big it is depends on our actions. So what would be the indications that Alberta is seeing a second wave?
Thank you, and I apologize for missing that question. Next time I'll bring my pen with me. So I'll start with that one first so I don't lose it. So the second wave, again, as you say, does depend on our actions. And ultimately, what we are watching for, a second wave, so to speak, would really happen if we had uncontrolled spread that accelerated through our province and that we moved into an exponential growth phase that we weren't controlling. And so far, we have been more in that sort of gentle ripple or wave, small wave, or the slow burn, as some call it, which is essentially we want to be able to have minimal number of cases so that we are able to control the spread from each individual case so that we're not seeing a significant health system impact and so that we're not seeing that exponential growth in cases. So it really is about the slope of the curve and how much transmission is happening. So again, as you have just said, it really is all in our hands about whether or not we have a second wave or not. And the first question now I have forgotten, and Shireen will help me.
Sorry, I lost it too. Julia, could you repeat it?
Sure, yeah. In determining close contact, how and why was 15 minutes chosen as that threshold?
I apologize. Thank you. So 15 minutes was chosen, and I have to be clear that that 15-minute threshold is really based on what we've seen is that casual close contact, so if you pass by someone in the street, that's unlikely to cause transmission. But if you're in that closer contact for a longer period of time, it can cause transmission. That's not to say if somebody sneezes directly on you or if there's that kind of close exposure with infectious fluids, that would, of course, be considered a contact. But if it's simply kind of being in that same space, having a conversation, then it does take a little bit longer for someone to be considered to be at risk. And that's, again, based on our current understanding of the evidence.
That's it for today. Thank you, everyone, for joining us. Dr. Hinshaw will provide the next update on Monday.